When you're turning 65, there are so many different Medicare insurance options out there. So what do you go with? Of course, you're going to click on that title in YouTube that says never do this, or I would never choose Medicare Advantage. Of course. They're wanting to reel you in to watch that video because they want to direct you the way that they want to. But being somebody who's a little bit different, I know not everybody's situation is the same. Not everyone's financial situation, not everyone's mental situation, not everyone has the same comfort level when it comes to their insurance. And plus, my mom taught me when I was very young is never say never. So today we will be debunking that statement that you will sometimes hear from agents saying never choose a Medicare Advantage plan. Are you ready to go grab today's nugget of knowledge? Let's go, shall we? Hey everyone, it's Kristen Maka with Medicare with Maka, and welcome to my YouTube channel, Kristen's Nuggets of Knowledge. If you can't tell, today's subject is near and dear to my heart. I will tend to get up on my soapbox, so I apologize, but I think it is very irresponsible for agents to make blanket statements like that. Everybody's situation is different. Their financial situation, their comfort level situation, you name it, where they live, access to doctors, access to plans. All of this is 100% different no matter where you're at, whether it's stage in life, whether it's town or city, you name it. Everyone's situation is different. So let's start debunking this statement of different agents out there telling you never to go on Medicare Advantage. But before we get on that, full disclosure, most agents, Medicare agents, are 100% commission. So of course, they want to push you to the plan that's going to get them paid. And let me tell you, when someone gets on a Medicare supplement, there's very rarely any need for them to call the agent. So it's one of the more easy plans to be able to sell. There's not that many restrictions, as far as you don't have to know doctor networks, you don't have to know all these different plans, whereas plans can change from county to county. And there's a lot of different counties within the United States. So for an agent to say, oh yeah, I could sell Medicare Advantage, but because it's easy, but I just don't recommend it. Selling Medicare Advantage is not easy. I have to be trained and certified every year, not only by the government, but by every single carrier that I represent. So selling and knowing about Medicare Advantage is not easy. It is difficult. But in some instances, that's just the best route for my client. Now, another full disclosure, I am licensed in Nebraska, Iowa, and Pennsylvania. And I will say 98% of my client base is in and around the greater Omaha area in Nebraska. So these are the plans that I know most about. I understand that there are lots of places within the United States where Medicare Advantage just should not be recommended, just based on network, based on plan. But here in Omaha, Nebraska, the plans here are really good. And I know that there are several other counties around the United States, several different states, where the opportunities for Medicare Advantage are extremely similar to the ones here in Nebraska. So let's now break down and debunk this statement. So the first thing that these agents like to harp on is the fact that Medicare Advantage plans are managed care plans. You've got no control. Well, what technically is a managed care plan? There's HMO, health maintenance organizations. There's PPOs, preferred provider organizations. There's POSs, point of service plans. And what all goes into having one of these Medicare Advantage plans? Well, first off, it may require you to have a primary care specialist on file. And I don't know about you, but I really don't see the negative downside about that. Having a primary care specialist on file with your insurance is probably a good thing. Now, I understand that you're like, well, what if I want to change? That's simple. Call the insurance agent or the insurance company and say, hey, I'm switching my primary care. And most companies, especially those in Nebraska, it doesn't matter what primary care you go to, if it's the one on file or not, you still pay that same copay. Another thing that they harp on within that managed care blanket is prior authorizations. So some of these plans are not just going to allow you to go to some cancer specialist in Utah when you live in Florida just because you feel like going to a cancer specialist. There are some checks and balances that you do have to go to. Go to your primary care doctor. What's your issue? Do you have cancer? Okay, let's move on. That's normally the progress and the process that you go through when you're figuring out what's wrong with you. So sometimes prior authorizations can be a little bit of a hiccup, but not necessarily. I've had clients where, they want to go see a specialist. They don't want to see the specialist that their doctor had initially recommended. They just give a call into the doctor's office and say, hey, I've researched this doctor. I'd like to go to him. And for living in Nebraska, in Omaha, Nebraska, there's a lot of doctor opportunities here. So I do understand that maybe you're in a rural area and don't have that many options, and you may need to go somewhere that's outside of that main service area. Now, there are a lot of different companies that will work with outside of service area doctors and some that don't. So yes, there are some ins and outs, but nowadays with the companies gaining a lot more popularity, doctors are a lot more willing to work with the Medicare Advantage plans than not. So it's at least worth a look if it is intriguing to you. Another thing that managed care plans like to do is have preventative services and different preventative care things that you do for yourself be incentivized. So a lot of these plans actually will give you a credit card or a gift card or some kind of incentive program for every single preventative service that you go do. So to me, I don't see what the negative downfall about a managed care plan is. Yes, sometimes there could be some hoops to jump through, but if you have a good agent on your side and if you're working with a good company, normally those hoops are like little bunny hops at max. And with these plans, they act on the drug side extremely similar to the prescription side of things, so a standalone PDP. So as far as the drug side of the plan, it's all the same. You're going to have, potential step therapies. You're going to have different drug tiers. You're going to have the option for mail order. So as far as the prescription side of Medicare Advantage, it works extremely similar to your regular standalone PDPs. So as far as these managed care plans being bad, I really don't see it. I understand people like their flexibility and their freedom. But as I said, since a lot of doctors are working a lot more closely with these Advantage plans, it's not really that much of a difference. 5 or 10 years ago, maybe yeah, but not so much anymore. The second section to really look at is the money side of things. All of these different agents are saying, hey, look, these private insurance companies are getting a check from the government. They're bad because they're for profit. I don't really see that as a negative. They're taking over your care. They're accepting that responsibility. Yes, they are receiving money from the government. And it basically breaks down to your Part A and your Part B premium is being handed over to these private insurance companies to manage your care for you, which rounds up to about $1,000 a month per individual when they're on these different plans. That sounds like a lot of money, but when you really break it down, these plans do a lot up front. There could be a gym membership that they're paying for, dental care, vision care, over-the-counter cards. you name it. There's a whole lot of extra benefits inside these plans that people just don't think about. They're incentivizing you to stay healthy so that there's less claims, of course. They're a for-profit company. But yes, they are taking over the management of your care. So, when you go to the doctor, preventative care, you're not paying anything. That's being sucked up by that plan. And that's what that company is getting that money to do, to be able to manage your care. So I just see that as like a necessary evil for a private insurance company to take that offloaded from the government, because that's what the government's doing. The government is saying, we don't want them on original Medicare, we want them with you. So we're going to write you a check so that you can handle them and we don't have to. And besides, the more people that get on the plans and the more profit that's within the plans, you see, all Medicare Advantage plans are overseen by CMS or the government. So whenever there's a particular amount of profit that is within the plan must re-enter that profit into the plan. So throughout the years, I've seen the max out-of-pockets drop. I've seen the benefits increase. I've seen co-pays drop. So there's a lot of benefits to more people getting on these plans. They can actually be better for the individuals on them. And that's another thing agents like to bring up is, oh, you're getting what you pay for. And if you're paying zero, then you're getting nothing. That wipes that statement right out of the water. As I will tell you, once again, I represent a lot of Nebraska companies, and they have $20 a month for over-the-counter benefit. They have gym memberships. You can go to places like Genesis, which is like 50-some bucks a month. So right there, now we're looking at 70 bucks. All right, you can get a dental plan, which covers what basic dental care benefits are, which dental plans are about 35 bucks a month. They cover vision care, which could be 15 bucks a month. Right there, that's a lot of money right out of pocket just for these preventative care items. I understand. Not everyone uses that, and that's okay. But it's there for them when they need it, and they don't have to pay an extra premium for it. Another thing agents bring up is, well, you don't have any issues with payment and, because yes, there are times on these Advantage plans where clients come to me and say, hey, we need to file an appeal, or they didn't cover this appropriately. I'd like to file an appeal. Something to that effect. I'm paying more than what I thought I was going to. I thought this doctor was in network. So there's sometimes a little bit more paperwork, but like I said, on the back end of that, those Medicare supplement insurance companies are not reaching out to you saying, hey, did you go in for your preventative care today? Have you had your mammogram? Have you had your colonoscopy? What is it? They're not trying to keep you healthy. They don't care. So, do you want a little bit more interaction or don't you? I don't know. It's up to you. Which brings me to the next topic of feeling in control. With original Medicare and a supplement, you feel like you have control. You can go to see whatever doctor, whenever, wherever. Go see a specialist out in California when you live in Florida, vice versa, whatever. And they think that on these Medicare Advantage plans, it's not as flexible. Like I said before, these plans are being more and more robust every single year. They're expanding, they're growing, they're changing their networks, they're allowing doctors to be more flexible within the plan. So more doctors are willing to work with these Medicare Advantage plans. So as far as being in control, it all depends. And most people, honestly, when you're living in major cities and you have access to these great Medicare Advantage plans, is it really a downfall that you can't go see a cancer specialist in Arizona when you can see a pretty dang good one here in Nebraska? So it just all depends. And two, as we talked about before, there are, yes, prior authorizations. And depending on the company, depending on the plan, depending on where you're at, you can just have a letter of recommendation from your PCP saying, hey, we need to have him go see this doctor. Maybe a little bit more expensive. And that brings us to our next point. A lot of agents that don't recommend Advantage plans say that these plans are more expensive when you go outside of the network. I can tell you straight up that there are several plans right here in Nebraska that is a PPO, so you can go in and out of network, and their pricing structure is exactly the same. The only one where it isn't exactly the same is your max out of pocket. So if you've gone in network and you've hit your max out of pocket, and then all of a sudden you go to a doctor and he's out of network, you will have to pay that copay. But more often than not, the average time people hit that max out of pocket is 2 out of every 10 years. So that's quite a bit of a difference. So not too many oftentimes will you ever be in that situation where you're going to pay more here in Nebraska, once again, where you're going to pay more for your out-of-network care versus your in-network care. And there are a lot of companies that are expanding their network from the actual counties to everywhere. United Healthcare is one of those ones where their in-network doctors are United States wide. And there are a couple different companies that are following suit or have a similar style where maybe you know that you're going on vacation, you give them a call, hey, I'm going to be in Florida. So, and then they say, okay, just let us know if you have an issue and we'll get you hooked up. So there's a lot of different ins and outs to these plans now that weren't there before. And I understand that they weren't there before. And that's why a lot of people are very hesitant to move towards them. But once again, we're debunking this blanket statement that Advantage plans should never be recommended. I don't believe that. There are lots of different instances where it's going to be really good for the individual. And we will dive into that further with our next point. And that, my friends, is cost. Most of you know by now how much of a nerd and a numbers person I am. So we are once again looking at this spreadsheet that I created. So as far as when these different agents tell you that it's more expensive on an Advantage plan, I beg to differ. So of course, when you get started on a Medicare supplement, you start in right away at some of the lowest rates. Probably you're looking at $100 a month on top of course, your A and your B. A and B, they're basically, you got to have them in place no matter which option you go with. So how much A and B cost is kind of a moot point. So we want to be looking at how much the premium of the Advantage, how much the out-of-pockets of the Advantage versus then your monthly premium with the Medicare supplement, as well as more often we see people that have to take care of that deductible and then also having a drug plan. So when we're looking down on this sheet, and let me just put in some numbers that reflect a little bit more what a person just starting out with a Medicare supplement, what that would look like. Okay, so here we see that it just annualizes everything. We've got our Part B premium annualized, we've got the supplement annualized, and then we tack on, this is already an annual number, the Part B deductible. So this right here, this $3,594.20 is the amount of money that you will be paying out of pocket for all of your health care and prescription care costs. So there's no guesswork because there's no extra, because like I said, we're saying that this is a Plan G. There's no other out-of-pocket expenses. So that's pretty reasonable, pretty affordable. And then when you look at here on the Advantage plan, you have your A and your B. There's no deductible in this particular plan. More often than not, the PPOs are going to have some kind of a premium involved. Around here, there's one that's a $19 a month premium. You have a max out of pocket. So as you utilize the plan, all these different copays go towards paying towards this max out of pocket. As I stated before, the average of hitting that max out of pocket is 2 out of every 10 years. So that's kind of what we're going to be looking at when we go through these different numbers. So you've got all the, different copays that are down here. And that is, of course, it depends on usage on this plan. So there is the potential risk of paying that $6,000. Now I know from the get-go, this looks like quite a bit of a difference. And I understand that a lot of people don't want to take that potential risk. Now remember, we talked about this hospital indemnity plan. More often than not, the only time you're ever going to hit that maximum out of pocket is if you go into the hospital, because our copays in this particular instant is almost $400 a day for days 1 through 5. So if you have 4 different visits to the hospital lasting 2 days each, that can add up quite a lot. But this hospital indemnity plan can mitigate that risk by a significant amount of money. So just being able to have this hospital indemnity can curb this max risk right here. But I also want to point out, when we're looking at this, right here is our annual pay for that you're going to pay out, like it's reflecting this number right here with the hospital indemnity tacked on. So as I stated before, like I said, the hospital indemnity really, really mitigates your risk as it's associated to hospital stays, which is the biggest hit on these Medicare Advantage plans. But we see that here our annual pay is getting higher, but that does not include, and this is when we just start out and we have a very, very low drug plan, we have a very low premium, we decide not to get any of these extra things in place. But let's say you're a little bit older. You're not brand new to Medicare. You've had your plan in place for quite some time. You're probably 72, something like that. And your plan premium could be $210 a month. Prescription drug plan, you've got a lot more drugs and they're better covered underneath a plan that pays $25 a month. You do have a dental insurance plan because you know it's important to take care of your teeth. Decided to pass on the vision and hearing, but you do have a gym membership and you like the gym that you've been going to for a while and it's kind of costly, $55 a month. So now we see that all this stuff starts to add up right here. This annual pay that you know you're going to pay out of pocket just to have all of this stuff in place is slowly starting to creep up in price. And it's really starting to get close to this number here. All right, so now we're starting to see the benefits of looking at Medicare Advantage. Of course, yes, this box right here, this max risk, is always on the table. But as I said, the average is 2 out of every 10 years. And so I went ahead and I looked at kind of what that looks like. So when we look at, let me scroll all the way over here. So we started out at $100 premium for our plan G, and every single year you're going to have an increase. I just picked a 7% increase. So we can see over the course of 10 years, the potential, in my opinion, minimum, because more often than not, you're going to have a little bit higher increase than the 7% every several years. So like maybe in year 5, maybe in year 8, you'll have more increases unless you decide to reapply. But that's going to be just about a standard look at what your premium will be for the supplement. And then we look here, this is your deductible. So this is the yearly cost, excuse me, of the Medicare supplement with the deductible tacked on. So over the course of 10 years, just to have this plan in place, you're going to spend $19,000. And of course, you have to have a prescription drug plan tacked on. So right here, $19,309.74. with a Medicare Advantage plan, just a Medicare Advantage plan alone. We've got the $19 a month that includes prescription drug. It includes this deductible here, which if you can see, I did increase the deductible. As we know, the deductible increases every year. I jumped it up by $5 every year, so not too crazy there. But we look here. So over the course of 10 years, if you don't have anything done, that's how much you'll be spending. Not a lot. And of course, if we tack on 2 years of hitting that max out of pocket, how much that you'd be spending over the course of 10 years. So there is quite a bit of a difference. Quite a bit of a difference when you look at the big picture. How long am I going to live? How many years am I going to have to pay? Yes, that max out of pocket is very, very scary. And of course, you could have several years when you're paying $2,000 out of pocket if you don't have a hospital indemnity plan in place. But other than that, if you're going in for, some kind of an x-ray or a scan or something, you may have, a $15 copay here, $150 copay there. But all in all, preventative services are taken care of, and you're really not going to see too much out-of-pocket costs when you have the hospital indemnity plan tacked on. So, yes, there is obviously that max out-of-pocket risk. But when we look at a 10-year glance, that can be quite different. And this is just starting out at $100. When I see people and they're paying $200 and they're like, no, I love my plan. I'm just going to stay on it. And then you start looking at this difference right here. Oh my goodness. Oh my goodness. That is a massive difference in cost. So it's something to really think about. I mean, like I say, I don't recommend it for everybody. But then again, I don't recommend supplements for everybody. It just all depends on the individual situation, where they live, what doctors they see, what their comfort level is, how much money they have. If they don't, would they be good with going with a hospital indemnity? Are they even health-wise qualified to get a hospital indemnity plan? There's so many ins and outs on the table. You have to look at the situation. You have to. And it's very irresponsible when agents don't and make those blanket statements. I know this was a lengthy video, so thank you for sticking with me. I hope this has helped you learn that when I recommend plans to people, I don't make a blanket statement. I think that gives every single customer such a disservice. You have to know the individual situation, know their wants, needs, and everything else like that. So if you enjoyed this video and you appreciate that I like to know everyone's specific situation to be able to recommend the right type of plan for them, please give me a thumbs up. Hit that subscribe button and the notification bell so you know next time that I put out a video. Everyone, God bless, take care, and I will see you next week.